Hi, my name is Mardia. Welcome back to my channel. And today, the goal of this presentation is to understand the which is the before, preoperative and post-operative testing of chin lift surgery. Without further ado, and this is from a pathology lab person perspective. So let's get right into it. So, what is the chain lift? You, several of you in the comments complained a lot about just going to the gym and getting that excess fat taken off. Several times, you cannot go to a gym to get your neck excess fat of your neck to be taken off. This is one of the few cosmetic procedure that are actually, I would say, required, and this is in my opinion. Um, Only because when you have excess fat like this, especially all the way through your jawline, you do not know what is underneath that. You can, for any reason, have some form of mold or so, or lymphomas or whatever growing in there, and so it's very important to have a provider take a look at it. And in this instance, these um, these girls in this surgery did the right thing by going and get this cosmetic procedure done at a provider who was very skilled at their jobs. So a chin lift, basically, it is a cosmetic procedure. It's a cosmetic surgery to tighten up your skin and enhance your facial contours and make it also helps make your face, your jawline more symmetrical. And as we all know, historically, the more symmetrical a person face is or look, the prettier that they are, the prettier they are seen or are told they are by people. So the standards of being pretty, one of the few standards having a very symmetrical face. So a chin lift will help get you closer to that symmetrical view. So, how can a pathology help a surgical provider doing this procedure? Well, first and foremost, pathology helps in diag- helping the provider, the surgical provider, diagnose the patient accordingly. They help with any surgical safety or contradiction. They help prevent complication before doing and after the procedure. They also help evaluate any form of abnormality in the patient tissue before and after the procedure is done, and also make sure that the patient is not allergic to any form of drugs or any form of medication that will be given to that patient. Some of the testing that are sent to the pathology lab to help in diagnosing or help in this procedure is a complete blood cells count, which is a CBC, a coagulation profile, a liver and kidney function test. And if needed, there would be some form of tissue taken out of the chain to be sent. Other time, or many, almost all the time, allergy testing will be done to make sure that the patient does not have any prior allergy medication restrictions. So a CBC test, when the provider is when this test is resulted back to the surgical provider, they will be looking at the white blood count, which is a WBC, and if it is normal, then you are in good shape. They will also look at the hemoglobin and sometimes the hematocrit to see your where you stand. They will also look at the platelet. The platelet is very important because all of these three tests, blood tests, kind of work. Um, together as a team, like in a circle. So the platelet will be double checked by a coagulation testing, which will come in a sodium citrate test tube, which is like a little blue top tube. And this test would test for your clotting factor, like your PTT, APTT, to make sure that there will be no issues with your platelet clotting when this procedure has been done, because they don't the goal is not to excessively bleed out, because we all know excessively bleeding will cause further damage and can lead to an emergency run. So the liver function testing are is done to just check your enzymes and make sure that all of your enzymes are working accordingly. Your kidneys, your livers are all working, and again, all of these tests kind of feedback of each other results to give the provider uh I would say like a little scope of what they are dealing with, you as a patient. So these tests are required. Most time, if you are doing the uh, surgical testing, it would be it's an outpatient procedure. You will have to call your provider. You'll go to like all different kinds of consultation. And before any of the pathology testing are run, there will be x-ray done, and these if something look abnormal within the x-ray, as you can see on this picture, MRI will also be done for any to just kind of give the provider a clarity of what is going on. And then once they feel like okay, we can proceed, that's when the pathology testing, as I say, will be done. So these can be done before and after depending on the provider. So, doing an intraoperative pathological monitoring, the provider, this is doing the procedure. So whatever tissue or skin cells that have been taken off of the patient during this procedure will be sent for further studies into a pathology lab, and most time these tissue will be sent as a frozen sample. Other time it just gets sent directly to like a HLA lab or immunogenetics lab, just to check and make sure that whatever that have been taken off will replenish accordingly, and that you won't have, again, the goal is to make sure that before doing and after the procedure are 100% safe, and there's no issue, there's no incidents that may or would come up. So the provider goal is to make sure and the provider wants to confirm that the patient is in all shape good, and these medical confirmation can later be used in case of malpractice lawsuit. So further testing is always recommended if there's any suspicious or any um, uncertainty in a patient who is getting a chin lift procedure. So in the post-operative pathology testing, I didn't put this here, but most from my little experience in the post-operative testing, another CBC will be performed, and another coagulation test will be performed, and just to check again, to double check that the patient is healing accordingly, and the results before and after are kind of symmetric, are matching in a way that's showing the provider that this patient is recovering accordingly, and there's nothing is alert in them. Other things that are mandatory that are performed in the post-operative, which is the after or before the surgery is done, I'm sorry, which is after the surgery is done, um, are CRP and SED rate, ESR. These tests are tested for inflammation. There are certain cells and cells that will fight off inflammation or any unknown growth in your body. And these testing will kind of alert the provider, like, okay, there is something. If these tests comes back right, or there's a high level, so these tests actually just test for high level of like inflammation. If the patient is not taking something accordingly, the level would be super high or just abnormal. And when that happens, the pathology will alert the surgeon that, okay, uh perhaps this patient needs to go back in, or you need to check again for certain things to make sure that the patient is actually healing accordingly. um, so this also help the surgeon to cover up them or protect themselves, and also most importantly protect the patient during the time that they are healing and getting to what would be considered their new normal. Okay, other suspicious wounds, like say if something else just happened to grow during the after your surgery has been done, any of that pieces of tissues will be sent again to just make sure you are healing accordingly and that everything is going well, and no further suspicious is the provider feels comfortable. So doing say there are in one of these the before, during, and after procedure, there something says something comes up. Okay, and this normally happen after they have cut up, or you have gone through the procedure, right? So there would be like or before, sometimes a good provider, a good surgeon would catch this before. If something, there will be like another growth that will happen after you have done the procedure, and that is suspicious. So these fatty, it would be like either a lymph nodes or something that inflamed. Okay, due to that, the provider would then seek further assistance. And if this was caught before the procedure, you will be recommended to a dermatologist. Like if you have any cyst or so, you'll be recommended to a dermatologist to get the cyst uh, to be removed instead of actually getting the fat removed. So when all of these testings are important, because it could be, oh, you cannot get this procedure because you have a cyst growing under your chin, and in order for you to get this procedure, the cyst has to be removed. And who's going to remove it? It's not. There are different providers who are different doctors for different things, because each, like a pathology specializes in several just sending a test to a pathology lab does not mean you are sending it to a hematologist pathology, because there is a microbiology pathology, there is immunogenetic pathology, there is biomedical pathologists. So there are different scopes and different labs in a pathology under the term pathology. So, and it's the same at surgeon. There are different scope, different aspects of providers who look at different things. So, however, there could be a provider who are double board certified to look at two things at once. So, a provider who is a cyst, who specialize in removing cyst, can also specialize in getting a chin lift. So then you have that same provider remove the cyst, then you can get your procedure done, you can get the chin lift done. Or in the instance where that your provider who is providing the chin lift procedure does not have uh, the medical utensils and background to remove a cyst, you will be recommended to a dermatologist or another provider who remove cysts and nodes and take care of those things before then being sent into a surgical lab to get your chin lift done. So you got to keep this in mind. Many times you cannot just work again. That I see lots of comments where people were in the comments saying, "Oh, you could just go to the gym and get that fat off." You can't just go to the gym and get a fat in a specific area out. You cannot. Okay? You cannot go get skinning in a specific area. Your body, your hormones, the stage of your life determines when and where the fat is going to be taken off. You can lose pounds when you go to the gym. You can lose weight when you eat healthy and reduce your calories intake and all that stuff. That will not make your jawline symmetrical. It would not remove the excess fat that would be under your neck. It would also not remove a cyst. If there was a cyst that was in your lymph nodes, it would not remove that. So when you are commenting online, make sure you are being very empathetic. Okay. Make sure you're being very empathetic and understanding how fat are distributed, because we are all different and we all lose and gain weight in different ways. And many times, if a person can go to the gym and get that done, get these certain procedures done, they will go to the gym and get it taken care of that way. However, it has not been the case. It is not the case when you see procedures like this, because you cannot just go to the gym and remove these type of fats. Okay, so moving on. Why are pathology so important? In pathology helps with safety, like they help the surgeon make sure they're making educational or to the best of their knowledge diagnosis. They ensure that the cosmetic procedure is done in a healthy way, and the patient will be properly healed after the procedure is done. Pathology helps identify any hidden components that may come up. So by doing your blood work and retesting your tissue, testing all of the different things, it helps. It is also very good for a provider to have a strong documentation on the patient, knowing what the patient in what things that could pop off, things that could come out of nowhere. It is very important to have a strong documentation on a patient before going into such procedure. So, more of the story again, we cannot go to the gym, okay, to remove fat from a specific area of our body. We can work at a certain area and on our body, like our muscles, and so, but that does not guarantee the fat is going to be moved. It can tighten it up, uh and that would be for a short period of time. When you get a surgery is faster, is instant, and it lasts much longer than going to the gym. Secondly, you cannot go to the gym if you are someone with a large neck who has lymphoma or any cyst growing underneath your skin, because that in itself will also require surgery. So it does not matter, and again, as I stated earlier, you have to when you have to be careful what you're commenting on the post. um, Not every part of our body can lose fat accordingly, or not every part of our body will lose fat. because we go to the gym consistently. Okay, so it's very important that we know that. And most procedure, if it is being done in a provider office, it's probably because the patient has already tried to um, work on it in a safe way without any knife or so. In summary, the pathology plays a very important role in screening, diagnosis, and safety. And before surgery, it helps rule out any risk. During the surgery, they help uh, immediate response of abnormality, any form of immediate response of abnormality that comes up. They help uh, kind of subsidize it and make sure the patient is coming out safe. After the surgery, they ensure a complete just to make sure the patient is healing accordingly and appropriately. Thank you so much for watching, and I hope to see you in my next one. If you're new here, please make sure you subscribe, like, and share. I truly appreciate you having this time and taking this time to really just we can just to really talk about this procedure. I hope to see you all in my next video.